Welcome, Empire State New Market Tax Credit Board members and others. I'd like to now call to order the meeting of the directors of the Empire State New Market Corporation for Wednesday, August 8th, 2018. I'd like to know for the record that I will be acting chairman for today's meeting. And further, I would like to note that this meeting is being webcast and we welcome public comment on the items on our agenda. The directors have received the relevant written materials in advance of today's meeting and are free to ask questions at any time. I'd like to welcome our newest member, Paul Tronalone, who is joining us from our Western New York office in Buffalo. Paul is VP of Policy and Planning for Western New York. Welcome, Paul.
Thank you. Glad to be here.
Before we begin with the substantive portion of today's meeting, I would ask the directors whether they have any potential conflicts of interest and with respect to any of the items on this agenda. If so, I would ask you to make an appropriate disclosure at this time, and we'll make sure you recuse yourself from any vote or discussion of the items. Hearing none, the first order of business today is the approval of the minutes from the June 20th, 2018 meeting. Do I have any questions or concerns? If not, I would entertain a motion for approval.
So moved.
Second.
All right, all in favor? Any opposed? All right, motion carries. Jonathan Hornsby will present the next item on today's agenda, which is a request, among other things, the authorization to adopt the proposed general project plan for the Boys and Girls Club of Schenectady. Jonathan.
Thank you, and good morning all. The directors are being asked to adopt the general project plan and to authorize a suballocation of up to $6 million of Empire State New Market Corporation's federal new market tax credits to be used for a portion of certain real estate development costs, including hard, soft, and transaction closing Club of Schenectady project in Schenectady, New York. The directors are also being asked to delegate to one or more authorized officers of ESNMC, acting in its own capacity or as managing member of the subsidiary CDE, the authority to determine the term of the NMC increments and to execute ESNMC and the subsidiary CDE in connection with the closing of the NMTC transaction. Boys and Girls Club of Schenectady, Inc. is the sponsor for the project that involves the construction and development of a new 38.6 thousand square foot youth development center to be operated by the Boys and Girls Club of Schenectady in the highly distressed Quackenbush Park area of Schenectady, New York. Boys and Girls Club of Schenectady is a nonprofit social services organization formed to promote, supervise, and administer the educational and recreational programs of the Boys and Girls Club of America in the Schenectady community. Since its creation more than 100 years ago, Boys and Girls Club of America evolved significantly, becoming an influential force in the youth development. It currently serves more than 4 million young people through membership and community outreach in 4,300 clubs throughout the country and the Boys and Girls of America affiliated youth centers on U.S. territory worldwide. Boys and Girls Club of Schenectady has been effective in helping young people set high expectations for themselves. The mission of the Boys and Girls Club of Schenectady is to inspire and enable all young people reach their full potential as productive, caring, responsible citizens. The organization provides young people with a safe place to learn and grow, ongoing relationships with caring adult professionals, and life-enhancing programs and future development experiences. The FBI has identified the city of Schenectady as the 11th most dangerous small city in the country with the highest crime rate in New York State. In this community, half of the high school students do not graduate. Schenectady is one of the smallest counties in New York State. However, it disproportionately has some of the highest rates of poverty, crime, pregnancy, and high school dropout. All of these factors are highest in the two neighborhoods where the facility will provide its programs, Hamilton Hill and Mount Pleasant. Upon the completion of the project, Boys and Girls Club of Schenectady will offer youth development programs which will focus primarily on teen career readiness, theater and performing arts, and commercial learning kitchen work program. The space will also include the operation of a radio station to allow students to learn how to be DJs. In addition, other programs designed to enhance academic performance and build competencies to ensure youth future success, including character education, alcohol and drug abuse and pregnancy prevention, and stimulated programs will be offered in the new facility. The project is estimated to create approximately 20 new full-time equivalent jobs. These jobs include 11 new full-time equivalent jobs and 10 retained FTE jobs. In addition, the project is estimated to create 63 full-time equivalent construction jobs. Without NMTC financing provided by ESNMC, the project could not happen. In addition to the $6 million NMTC allocation provided by ESNMC, the project will receive a $6 million NMTC allocation from the Community Builders CDE LLC. The project will also receive approximately $3 million grant funds from HCR's Community Investment Fund, and JP Morgan Chase Bank will serve as the tax credit investor for the project. The construction of the new facility enjoys significant support from government agencies, community stakeholders, and private organizations. It also is part of a strategic effort by the City of Schenectady to develop and revitalize two communities which have been impacted by multiple social issues. The project is a key component of the redevelopment of Hamilton Hill, Mount Pleasant, which has received significant investment to revitalize various aspects of the community, including housing, commercial, and supporting services. There are several housing projects being undertaken and others that have been recently completed. The directors are hereby requested to authorize the adoption of the proposed general project plan and the suballocation of up to $6 million in new market tax credits, to authorize performance of certain acts in connection with the suballocation of NMTC, the ESNMC subsidiary CDE 6 LLC, and the closing of the NMTC transaction, and to determine significant.
Thank you, Jonathan. Any questions or comments from the directors with regard to this item?
I just have a couple of quickies. Is it a standalone structure or is it part of a larger development?
It's a standalone structure, yes.
And do you know, is it on public land or did they purchase the land?
The Boys and Girls Club of America purchased the land, and the Community Builders is also involved in the project.
Great, thanks.
Any further questions? Any comments or questions from the members of the public that don't appear to be here? Excellent. Do I have would entertain a motion for approval?
Motion?
Second?
Second.
Favor?
Aye.
Aye.
Any nays? Thank you. The motion carries. John Evan will present the final item on today's agenda, which relates to the St. James Hospital Medical Office Building Project. John Evan.
Thank you. The directors are being asked to adopt a general project plan and to authorize the allocation of up to $8 million of Empire State New Market Corporation's new market tax credits to be used for a portion of the cost to fit out and purchase equipment and FF&E, as well as pay related and administrative costs for the St. James Hospital Medical Office Building Project in Hornell, New York. The directors are also being asked to delegate to one or more authorized officers of ESNMC acting in its own capacity or as managing member of the subsidiary CDE the authority to determine the terms of the NMTC transaction documents and to execute such NMTC transaction documents on behalf of ESNMC and the subsidiary CDE in connection with the closing of the NMTC transaction. St. James Hospital is the sponsor of the project that involves the fit-out and equipping of a medical office space in the highly distressed area of Hornell, New York. Founded in 1890, St. James Mercy Hospital, now St. James Hospital, has provided health care services to residents in the Hornell and surrounding communities for more than 125 years. During this time, St. James Hospital has evolved from its humble beginnings as a small rural farmhouse to the regional full-service hospital it is today. St. James Hospital provides compassionate, quality care and offers a full range of inpatient and outpatient services, including emergency, acute medical and surgical imaging, and laboratory. The project involves the fit-out and equipping of medical office space in a portion of the medical office building that St. James Hospital is leasing from a private developer. St. James Hospital's leased space includes approximately 19,000 square feet for the relocation of the current extension clinics provided by St. James Hospital, the relocation of program services from the main campus hospital location, and addition of new extension clinics, a primary care clinic, and a specialty clinic. The project is an important component of the medical office building, which in turn is a component of the Hornell Medical Village that involves the redevelopment of land to create an integrated healthcare services delivery model for a rural, low-income area in upstate New York. The integrated healthcare services delivery model is designed to meet all the individual patients' needs in one central location. thereby improving care coordination and reducing readmissions. Bringing primary care, specialty care, emergency medicine, and outpatient services together at one site increases convenience and efficiency, but more importantly, directly supports staff and providers in caring for all individual patient needs and improving the overall health outcomes. Hornell Medical Village includes two key components. The first component is the construction of a new hospital by St. James Hospital, and the second is the medical office building where medical services that are complementary to those of the hospital will be provided to this low-income rural community. St. James Hospital is building a new two-story, 87.3 thousand square foot hospital. The hospital will primarily focus on outpatient surgery procedures and a 15-bed inpatient unit. The medical office building sits on approximately 10.5 acres of land. The existing building was previously used as a Kmart shopping plaza and has been abandoned for years. A private developer is redeveloping the site into an approximately 118,000 square foot first-class medical office where multiple medical tenants will provide medical services in one location to deliver comprehensive quality care to this rural, low-income community. The project allows for significant healthcare expansion. Today, St. James Hospital's facilities allow for 22,918 annual visits. St. James Hospital's project in the medical office building that ESNMC is financing is expected to allow St. James Hospital to nearly double site visits by 2020 to 40,610 annual patient visits for services that it provides within the medical office building. Through this investment, St. James Hospital expects to create approximately 12 and retain 73 new full-time equivalent local jobs as part of the St. James Hospital project that ESNMC is financing within the medical office building. Without ESNMC financing provided by ESNMC, the project could not happen. Wells Fargo will serve as leverage lender and tax credit investor to this project. The support for Hornell Medical Village project has been significant. Locally, it is supported by the City of Hornell, the Steuben County Manager, the Steuben County Industrial Development Agency. Also, Mayor Hogan, former mayor of Hornell, who is on our ESNMC advisory board, strongly recommended this project for investment as a linchpin to catalyzing investment in Hornell and transforming healthcare in this rural low-income community. Finally, St. James Hospital has received New York State grant awards in the amount of $55 million from the Essential Healthcare Provider Support Program and $7.9 million from the statewide Healthcare Facility Transformation Program to fund the new hospital construction and electronic medical record implementation. The directors are hereby requested to authorize the adoption of the proposed general project plan and the suballocation of up to $8 million in new market tax credits, to authorize performance of certain acts in connection with the suballocation of NMTCs to ESNMC 7 LLC and the closing of the NMTC transaction, and to make determination of no significant event on the environment. Thank you.
Great. Thank you. Any questions or comments from the directors with regard to this item? Are there any questions or comments from the public? If not, I would entertain a motion for approval.
Motion?
So moved.
All right, second.
Second.
All in favor?
Aye.
Aye.
Any opposed? Thank you. The motion carries. Thank you, everyone, for your participation in today's meeting. There being no further business, I will call for a motion to adjourn.
Move.
So moved?
Yes.
Second? Adjourned.